Okay, Betsy, it's very nice to have you back,
I know, it's great to be back.
but not as a patient this time.
Yeah,
Fantastic.
exactly, yeah.
And you look great. You look
Thank
great.
you.
And
Thanks.
I was really looking forward to talk to you because I'm sure that you have a very nice experience to share with us.
Yes, I do. I have a very nice experience here. It was great.
But what I would like to ask you a little bit about your journey since you were diagnosed. What went through your mind at that particular time?
That was the most frightening day of my life. It was like getting a death sentence, and I just could not believe it. It was so frightening that I didn't sleep for 24 hours, and I just, didn't know what I was going to do because I thought that cancer was the end of the world. And then, I realized it wasn't. And not just because I got used to the idea of it, and then, to tell you the truth, once you're in the right place getting the right treatment, you feel that you can see the light at the end of the tunnel.
But until, what was the journey to get to our clinic? What your primary doctor told you the very first time? What were your options?
My options were chemotherapy, and they first told me that I could do the kind that I didn't lose my hair, but then they did give me the kind that I'd lose my hair with, and they said I would have to do radiation and have maybe a lumpectomy and possibly a mastectomy. But I think that they were planning on a mastectomy because the lump was quite large. So it was, so I ended up going through some chemotherapy, and I could feel the lump the whole time because I'm the one that found the lump to begin with. And the lump was quite large. It was 6 centimeters. And so the whole time I was doing the chemo, it was every 3 weeks for 6 months. It did not shrink, unfortunately.
So you were with that treatment for 6 months? 6
months, every 3 weeks.
And how did your body react to that chemotherapy?
Well, the first 4 rounds were adriamycin Cytoxan, and it was not very nauseating, and for at least 24 hours I didn't feel good, and then for 2 weeks I was kind of not feeling that great, and then by the 3rd week I'd have to have it again and then go through the whole process again, and then I had 4 rounds of Taxol. And so I finished all the chemo, and it shrank just a little bit, the tumor. It was still very hard and still very large. And I could feel it the whole time, and it worried me because I constantly felt it to see if the chemo was making it shrink, and it didn't, unfortunately.
How long ago was that?
That I was diagnosed in June of 2000. And I started the chemo in July of 2000.
And did you lose most of your hair?
All of it.
So is that your natural hair?
Yes, this is my natural hair. Now, it did grow back, and I was the hairless wonder for, about 8 months.
So it wasn't a very nice sight for you?
Yes. Yes, very.
And so after that, you had to decide to treat something, to treat something else.
Yes, yes.
I mean, to try.
Yes.
So.
Yeah. So so what happened is I went through all the chemo, but they did not operate on me they were going to shrink it first, and then operate to hopefully so I didn't have to do a mastectomy. But since it didn't shrink very well, anyway, it was 2 weeks before my surgery that I found Dr. Beecher, and the way I found Dr. Beecher was I went to another doctor's office, an alternative doctor out in Long Beach, and he had some brochures of the Moss reports. And so I found that brochure, and I decided to get the Moss reports, and that's how I found Dr. Beecher. And I was so surprised that he was right here in Los Angeles. It was just, you know, I was like, well, how come you don't hear about these places, you know? So that's when I came to visit Dr. Beecher.
And that was in 2000 or 2001?
It was 2000, November of 2000, just after
November
I finished.
2000.
Yeah, finished my the chemotherapy, and then it was 2 weeks before I was going to have the lumpectomy, or whether it was going to be a mastectomy. And I feel so lucky that I found Valley Cancer Institute instead of going through that surgery.